All right, so somebody left me this link. Let me go ahead and run this real quick and take a look at this. This is from clinicaltrials.gov. COVID 19 is an emerging, rapidly evolving situation. That's right, be scared. Okay, so COVID 19 vaccine messaging part one. Now, I'm not exactly sure what this is, so if anyone really knows what messaging is, I don't know. I don't know if this is strange. Let's read this together. So there's a disclaimer. It says it's not. They don't. It's nothing unless the federal government hasn't been evaluated. The sponsor, of course, Yale University. Yale University is these people that actually ordered live babies. That Yale and Stanford and all those guys. They're the ones who took the babies that had been DNR'd and, of course, went and harvested everything, right down to everything out of them. So these people are some awesome people. Brief summary here. This is where it gets strange. This study tests different messages about vaccinating against COVID 19 once the vaccine becomes available. Participants are randomized to one of 12 arms, with one control arm and one baseline arm. We will compare the reported willingness to get a COVID 19 vaccine at 3 and 6 months of it becoming available between the 10 intervention arms to the 2 control arms. So this sounds scantless. I don't know what it is, honestly, other than there's 4,000 people in this test. I don't know interventional clinical trial, allocation randomized intervention model parallel assignment. In this study, 2/15, I don't know if it's 2 out of 15 or what they're even saying because there's 4,000 people, so maybe 2/15 of the entire group will be assigned to a control message, bird feeding passage, 3/15 of sample to a baseline vaccine message, and 1/15 to each and the 10 other treatment arms. I think they're just calling people arms. So I think some of these people get, I don't know what the deal is here. I think they're just screwing with people to see if they're willing to take this vaccine when it comes out. Of course, here's the key word right here: sham. Sham compartor. The control message and about bird feeding. Other control message. Are we the birds? Or what are we? Are we? What are we here? I know we're the goy, but are we the birds? 2/15 of the sample will be assigned to the pure control group, which is a passage on the costs and benefits of bird feeding. These participants will be assigned a message about the benefits of vaccination. All other treatment arms include this baseline language. So I think they're testing how to mind control us the best, if I'm reading this right. 3/15 of the sample will be assigned to a control group with a message about the effectiveness and safety of vaccines. So they're taking these 4,000 people and figuring out how best to mind control these people. The experimental message arm. 1/15 of the sample will be assigned to this intervention, which is a message about how COVID 19 is limiting people's personal freedom, and by working together to get enough people vaccinated, society can preserve its personal freedom. This is so evil. This is completely evil. Experimental message arm. 1/15 of the sample will be assigned to this intervention, which is a message about how COVID 19 is limiting people's economic freedom, and by working together to get enough people vaccinated, society can preserve its economic freedom. Wow. Experimental message arm. 1/15 of the sample will be assigned to this intervention, which is a message that COVID 19 presents a real danger to one's health, even if one is young and healthy. Getting vaccinated against COVID 19 is the best way to prevent oneself from getting sick. Wow. Yeah, it is. Here's another experimental message arm. 1/15 of the sample will be assigned to this intervention, which is a message about the dangers of COVID 19 to the health of loved ones. This is like complete mind programming. This is insanity. And they're going to take these 4,000 sheep and they're going to sit here and they're going to screw with them and they're going to see which ones of them freak out and how to get most people so they're ready to take this vaccine. This is insane. The more people who get vaccinated against COVID 19, the lower the risk that one's loved ones will get sick. Society must work together and all get vaccinated. I'm getting sick reading this. Back to this one. Here's it is. 1/15 of the sample will be assigned to this group, which is a message about how COVID 19 is wreaking havoc on the economy. And the only way to strengthen the economy is to work together to get enough people vaccinated. Here's the next thing. 1/15 of the sample will be assigned. The 15 compared is the 4,000 people. So 1/15 of this is, I don't know what it is, but my Common Core's failing me. But 1/15 of the sample will be assigned to this message. The message is about the danger that COVID-19 presents to the health of one's family and community. The best way to protect them is by getting vaccinated, and society must work together to get enough people vaccinated. Then it will ask the participants to imagine the guilt they will feel if they don't get vaccinated and spread the disease. Guys, why are we like a whole bunch of sheep to the frickin' slaughter? 1/15 of the sample will be assigned this message. The message is about the danger that COVID-19 presents to the health of one's family and community. The best way to protect them. I feel like I'm just going over the same things over and over, but I think they're mind controlling us in every way, shape, and form. The best way to protect them is by getting vaccinated, by working together to make sure enough people get vaccinated. It goes on. The mind control rolls on. This one is to presents the best way of one's health and community. The best way to protect them is by getting vaccinated, by working together to make sure that enough people get vaccinated. Then it asks participants to imagine the anger they will feel if they don't get vaccinated and spread the disease. 1/15 of the sample will be assigned to this message about how getting vaccinated against COVID is the most effective way of protecting one's community. Vaccination is backed by science. If one doesn't get vaccinated, that means one doesn't understand how infections are spread or who ignores science. They're just telling us right ahead of us. They're brainwashing us to this freaking vaccine, folks. 1/15 of the sample will be assigned to this message, which describes how firefighters, doctors, and frontline medical workers are brave. Those who choose not to get vaccinated COVID-19 are not brave. That's it. The primary outcome measures. Intention to get COVID-19 vaccine. Time frame. Immediately after intervention in the same survey in which the intervention message is provided. This is a self-reported measure. This is a self-reported measure that the moment self-reported immediately after the intervention message of the likelihood of getting a COVID-19 vaccination within 3 months and then 6 months of it becoming available. During an analysis, responses among those assigned to different intervention messages will be compared to those in the control group. So this is how to properly, completely mind control us, folks. Vaccine confidence scale, time frame, immediately after intervention. Persuade other items, time frame, immediately after. Persuade. Guys, this is straight up mind control. They're telling us that this is what they're going to be doing to us and how they're doing to us. And now they're running tests to see if what they're doing will be effective. Fear of those who have not been vaccinated. Time frame, immediately after intervention. So they're going to mind control these people, and then they're going to say, would you like to take the COVID-19 vax? And they're going to see how many people, after they scare the living bejeebies out of you, will take the vax. So this is insanity. I cannot believe I'm even reading something like this. And that there's 4,000 people that are willing to be sheep. Obviously, these 4,000 people have never seen this, or this test would never work. So these poor sheep are probably in a little room right now getting completely drilled. So what is the date today? July. So we're August. So this is in July. So this is already done. It's already said and done, folks. Study date. So they already have this data. Guys, it is August. It is, this was in July. They're moving forward with this. They already know how every one of these people will react, and they've already used every bit of this data thanks to Yale University. I think these fine skull and bones Satanists. Yep, all of these guys roasting in hell, no doubt. No doubt there's a special place in hell for all these peaks. So, guys, we need to be diligent in what you're doing, everything. I tell you, 176 days. It's time to get food. It's time to get everything you can to survive this coming up. This is happening. So you see what they're doing on this. When the vaccine is out, there's a 3-month and a 6-month period. They already know how you're going to react. So most of the public, I think, is going to take this, and it's what they're doing is they're getting the masked people to fight against the unmasked people and these wake people to fight the sleeping people. So be diligent. I'm out.